ABC 10 News at 11 starts now.
If we see these trends continue, the potential for a stay-at-home order for those regions in purple.
The governor warning another lockdown is looming. COVID cases are surging across the state and here in San Diego. Good evening. I'm Steve Atkinson.
And I'm Kimberly Hunt. Hospitals across the region are preparing for even more COVID-19 related patients in the coming weeks. ABC 10 News reporter Mimi Alcala heard from Palomar Health's chief medical officer about the plans to help other hospitals if they become overwhelmed.
Palomar Health has had the room to take on more COVID-19 patients from other hospitals for several months now. It hasn't needed to, but in the next few weeks, that may change.
We've seen a significant increase, 89% increase over the 14-day period.
COVID-19 related hospitalizations continue to surge across California. Without any intervention, Governor Gavin Newsom says current projections show hospitalizations could increase 2 to 3 times the current amount in just 1 month. San Diego County is also seeing numbers rise.
We're seeing about 3 times the number that we saw just a couple months ago. 25% of the positive patients are ending up in the ICU. That's less than we saw during the first spike.
Dr. Omar Khawaja is the chief medical officer for Palomar Health. He says he expects more hospitalizations in the coming weeks as COVID-19 cases related to Thanksgiving gatherings start to show up. Inside of Palomar Medical Center in Escondido, a federal medical station is set up with 202 beds that haven't been used yet. Khawaja says they're ready to take on COVID-19 patients from other hospitals across the county that become overwhelmed. But this setup is not meant for ICU patients.
It could be beds that we would be able to offload some of the less sick patients from other systems into there so that they could handle the sicker patients. We don't have a solid plan in place for it yet.
He says the details are actively being discussed with other medical officers.
Are we worried? Absolutely. Is the spike coming very quickly? Yes. But we do have some capacity and redundancy available now, and we are planning to have even more.
Creating more capacity could include scaling back on the number of elective surgeries scheduled. But this time, Khawaja says it'll look much different than what we saw months ago.
What we've done is essentially looked at surgeries and classified them in terms of how long could this be put off to be safe. We all saw that just shutting everything down led to some really just poor patient care, and we don't want to do that again.
Mimi Alcala, ABC 10 News.
Here are the latest numbers. The county reported 959 new cases today. That brings our total to over 82,000. There were no new reported deaths, typical for a Monday, so that number remains at 997. The South Bay is still being ravaged by the coronavirus. The hardest hit zip code seeing an increase of nearly 1,300 cases. That's just in the last 30 days. Our ABC 10 News reporter, Laura Acevedo, shows us how local groups continue working nonstop to slow the spread.
The South Bay has been the hardest hit since the start of this pandemic, and local organizations continue doing outreach, providing supplies and encouraging testing. Like much of the state, most of San Diego County is in a sea of purple with quickly increasing COVID-19 cases. But in South San Diego, some zip codes have more than doubled their case rate in recent weeks. The zip codes with large Latino populations. The 92154 zip code has the most in the entire county with over 4,500 cases, over 1,200 of the region's cases just within the last month.
The disproportionate number of frontline workers that live in that zip code.
The zip code includes neighborhoods like Otay Mesa, Nestor, and the Tijuana River Valley. Nancy Maldonado with the Chicano Federation has been leading the charge to help slow the spread in these communities.
Providing them the protections that they need when they're at work because they are exposed.
Maldonado says the region will continue to see these disproportionate numbers because many who live in the area are essential workers and live in multi-generational households.
Knowing that they have multiple people living at home and are exposing them to the virus because of their job, and something that they have to continue to do because they have to continue to go to work.
Over 7,000 COVID-19 safety kits have been distributed. Now the focus is on the holidays, making sure people stay home to stay safe.
So family oriented, and the holidays are all about family, but really pushing the message that this year might look a little different, but we have to do this in order to be able to go back to normal.
Laura Acevedo, ABC 10 News.
A San Diego church continues to hold services at several locations despite multiple cease and desist orders and an outbreak at one. We saw people not wearing masks walking out of the Awakened Church's indoor services yesterday. 3 of Awakened Church's locations have received cease and desist orders, yet a video posted to their website says they will still gather in person and indoors. One of the 3 Awakened Churches had an outbreak.
The Awakened Church in general has continued to be very defiant and continue to put the members of their church at great risk, and continue to not cooperate as we seek to investigate positive cases.
A local constitutional law professor says the more conservative U.S. Supreme Court may now be more sympathetic to churches claiming religious freedom violations.
San Diego's cooler temperatures have restaurants coming up with unique ways to dine outdoors. But as ABC 10 News reporter Rachel Bianco shows us, some makeshift dining areas are safer than others.
There is no lunch rush at Perioli Italian Bistro in Solana Beach. The longtime family-owned restaurant is open just 4 days a week now.
Problems of retaining employees because we had to cut their hours since we know we don't have a lot of business.
Like countless restaurants across San Diego County banned from indoor dining, Piero Tarantino invested in an outdoor setup.
It's not comfortable, because you have eat coming from one side, but then the rest of your body's cold.
Restaurants across the country are coming up with unique ways to dine outside, from igloos to individual pods, tents, and canopies. Dr. Anne Ramoyne is a UCLA epidemiologist. She says some of these outdoor settings still don't have adequate ventilation.
The issue is that it needs to be completely open, wide open. Ventilation, if you have a roof, if you have sides, that is not outdoors. Outdoors means in the open air.
California's Department of Public Health recently issued the following criteria for what classifies a setting as outdoor. 50% of the structure has non-adjacent impermeable walls. Circular structures with 50% non-continuous impermeable walls. Ceilings, roofs, umbrella peas, or canopies with no walls. Outdoor dining is banned right now in Los Angeles. Tarantino says if that happens here, it would be the final blow.
Now we are in a position where we're not able to pay the rent, and he's asking me to move out.
Supervisor Nathan Fletcher says right now there is no plan to shut down outdoor dining in San Diego. Rachel Bianco, ABC 10 News.
Health experts also say people dining outside should try to maintain more than 6 feet of separation when they're not wearing a mask and with people outside their household.
More Americans are now hospitalized with COVID-19 than ever before, and the numbers don't yet reflect what experts say could become a surge upon a surge following Thanksgiving. More than 96,000 Americans were hospitalized in the past 24 hours. That breaks yet another record. Dr. Anthony Fauci says the impact of Thanksgiving travel and gatherings is still yet to be seen.
You don't see any difference for a day, 2, 3, 5 days. You see the difference 2 or 3 weeks from now, which would put it right at the time that people would be traveling for Christmas. So all things considered, we're not in a good place.
There is hopeful news tonight on the vaccine front. Additional shipments of the Pfizer vaccine have now arrived in the U.S. from Belgium to supplement what we already had. It's ready to be shipped across the country within 24 hours of the government authorizing it for emergency use. That's expected to happen after December the 10th.
President-elect Joe Biden received his first presidential daily briefing on classified information and national security today. Biden is expected to take office in 50 days and is putting together a diverse White House. He's nominated several women to hold key positions, and for the first time in history, Biden will have an all-woman communications team. Meantime, more states are certifying their election results. Arizona and Wisconsin made it official today.
The controversial doctor who became a top COVID advisor to President Trump is now resigning. Scott Atlas worked at Stanford. He rose to prominence in appearances on Fox News, touting herd immunity theories that support widely reopening the economy and schools. President Trump added him to the White House coronavirus task force. There, Atlas, though, butted heads with other scientists and experts who believe his theories are dangerous.
A post on the Nextdoor social network could provide a clue about the murder of a woman in Carlsbad. It's been 1 week since someone stabbed Lisa Thorborg to death on the Hosp Grove Trail. And police say 2 weeks before she died, Thorborg asked on Nextdoor if anyone would care to join her for hikes and walks. And they're now conducting interviews based on that post. Yesterday, a group of people in the community came together to finish the walk that she started last Monday.
We don't want our parks taken away from us, and we don't want to live in fear.
So far, the tip involving a man seen in the area around the time of the murder has not panned out. Anyone with information is asked to call Carlsbad Police.